Hi, I'm Dr. Thaïs Aliabadi. For over 25 years, as an OBGYN, I've helped countless women navigate the challenges of PCOS. I created OV to bring you a scientifically backed solution that supports the symptoms of PCOS with powerful ingredients. OV supports hormone balance, body composition, metabolic support, and beauty from within, giving you a comprehensive approach to supporting your health. It's more than just a supplement. It's a product born from decades of experience and a deep commitment to women's health. Visit OV.com to learn more and start your journey to better health today. That's OVII.com.
Hello, listeners. Mary Alice here. August is National Eye Exam Month, and on this episode of SheMD, our guest is Dr. Kerry Assil, a world-renowned ophthalmologist specializing in refractive and cataract surgery. I'm telling you, if you had any questions about your eyes, it was answered in this episode. Kerry Assil is known for treating a number of high-profile and celebrity patients, particularly in the world of sports and entertainment. But he also did my and Dr. A's refractive surgery, which helped me throw away all my millions of reading glasses. As always, thank you for listening to SheMD. If you haven't had your eyes checked in a minute, now is the time. If you're uninsured or underinsured, Eye Care America is a public service program of the American Academy of Ophthalmology. You can go to aao.org/eyecare-america to learn more. Now here's our talk with Dr. Kerry Assil. Today on SheMD, we are so lucky to have Dr. Kerry Assil, and he is a world-renowned board-certified LASIK and cataract surgeon. He has worked on the eyeballs of incredible athletes like LeBron James. But I think the most important person that you probably ever worked on and fixed her eyeballs is Dr. Thaïs Aliabadi.
Yes.
Well, first of all, what do LeBron's eyeballs look like? I think everybody wants to know that. Besides that, which I know you're not going to tell me.
So before we start, I just want to say he's one of my dearest friends on this planet. He's probably the smartest guy I've ever met in my life. He's the most caring. And on top of all this, he took a desert in Peru and with two of his best friends, they turned it into a blueberry farm, right? And they are one of the biggest exporters of blueberries now in the world.
If you're looking for things that are good antioxidants, of course, blueberries have just about the highest concentration of antioxidants of any nutritional food. So
eat your blueberries.
What is your brand called?
Fruitist.
So this is just a little side hustle other than treating LeBron James's eyeballs.
He does it all.
But Kerry, I think what's happened to me when I hit perimenopause is all of a sudden, and it happens to everybody, but you just can't read anymore. And I had LASIK surgery in my 20s, and I was always told if you had LASIK, which fixed your vision from far away, you couldn't fix your vision for reading. And so I carry around these glasses everywhere I go. And honestly, it's a real pain in the butt.
A fun way to track what you just described about when you were in your 20s and stuff, you know, you can think of vision correction for life, right? When we're little kids and we don't see well, they give us a pair of glasses. We get a little bit older, now we can be responsible with washing our hands. We get to have contact lenses. We get a little older yet, the contact lenses maybe start to bother us or they're a hassle. Then we start thinking about LASIK, right? Now you've had LASIK and you were told there's nothing else that could be done. Absolutely not true. You could first have further LASIK, just like some people will wear a contact lens for near and distance called monovision. Or you could have a procedure called refractive lens exchange, which I had 8 years ago on my own eyes. And Thaïs was describing.
They know me as Dr. A. Just kidding.
I can't say Dr.
It's
T.
hard for me too. I say Thaïs, and she's like, yeah.
They're like, who's Thaïs?
In front of that, I worked really hard to get there.
So with LASIK, everybody has kind of intuitive understanding by now. It's become a household name, right? With LASIK, we take the cornea, the outer lens of the eye, the fixed focus lens, and the most powerful lens of the eye. We create a flap in it with a laser, and then we use another laser called an excimer laser that's so exquisite, it could actually sculpt a person's name onto a human hair. And we reshape that cornea, therefore, the deeper layers of it. And then the flap goes back in place. People sit up, they can see, they want to name their child after you. Everybody's crying and laughing and hugging, right? So that's LASIK as we've known it. But the eye's like a camera. There's two lenses in the eye. There's that outer lens that we described. If we think of this as being that outer lens in the cornea, and if we think of this as being the iris, the colored part of the eye behind it, there's another lens that sits behind that that's a zoom lens. It changes shape in order for us to see things over different distances. When something is far, it sits relatively relaxed position if you don't need glasses. And as things come closer, it zooms more and more and more, keeps things in focus. And if they were farsighted naturally to begin with, and that lens in the eye was working overtime just to help even with distance, but they weren't aware of it, then as it gets stiffer and stiffer, middle range and distance starts to blur, and that's when they tend to come to me. Oftentimes they come in still just asking for LASIK because that's the household term, but most people over the age of 50 certainly are better candidates for what we call refractive lens exchange. What do we do in that procedure? What we do is we take advantage of the fact that we have optical systems now that we had originally created for cataract surgery that we can bring into play for these folks. Why is it that people need this? Why is it that that lens stiffens to begin with? What happens with that lens is that the proteins in it start to change after a certain age, and so the lens gets stiffer and stiffer. It goes through 3 stages of fatigue. Stage 1, arms get too short. Stage 2, people feel like they need more light to see with, right? Stage 3 is when the lens, that same lens, starts to lose its transparency and becomes opaque, and then we call it a cataract, right? So refractive lens exchange is done usually just before an actual cataract comes on, and therefore also eliminates the need for future cataract surgery, and that's why we refer to it as a permanent treatment. What do we do with that surgery? We take advantage again of all the technologies we developed for cataract surgery, which allow us to enter the eye with little probes that are less than 2 millimeters in size, and we can liquefy the core of that original lens, leaving the outer shell behind, because the outer shell is connected to the eye 360 degrees through little tiny ropes. Think of like a hammock or a trampoline, right? And what we do is we take a lens that rolls up on itself like a newspaper, it goes through that tiny opening, and it kind of opens up within that shell. This new lens has what we call diffractive optics built into it. And once it opens up and it's in the eye, you're done. The entry sites that I had created are so tiny, they spontaneously seal during surgery so people can resume their normal activities the next day.
So can they read and see far away?
Yes, because of the diffractive optics.
I was using, I do laparoscopic surgery. It's minimally invasive surgery, and my incisions are 5 millimeters. So when I operate, I'm looking at the monitor. Yeah. I could see everything. But when it came to closing the skin, I had to ask the nurse to look into my bag for my glasses, take my glasses. I'm scrubbed in. I can't touch my glasses. She would put them on. I would suture my skin incision. So it was so difficult for me. I could not see the menu at night. Reading was an issue. My font, he used to make fun of me because my font on my phone was the biggest. Like I would have one word.
She couldn't keep any secrets.
Totally. Everybody's looking at your phone.
And one day I kept calling him, and he said, there's this lens coming. Wait. There's so much. We're getting more information on it. Finally, I think, 6-7 months ago or 8 months ago, I called him one day and I'm like, this is exhausting. I can't. I had 50 glasses in my office, around in every drawer in my office. I was constantly looking for it. It was so annoying. I couldn't deal with it anymore. So I called him. I think it was Thursday night, and I was like, I can't take this anymore. And he said, come, you want to do it tomorrow? I have to tell you a story full circle. When I had my surgery with him on Friday, That Monday, I had to do a cerclage procedure. Cerclage is when we stitch up the cervix, and you really have to put a speculum in the vagina, and you have to do a stitch on that cervix. And as I was doing this, my patient was awake behind, the drapes, and she said, "Oh my God, I love my doctor," and she was complimenting me. And the anesthesiologist made a comment. He said, "The most amazing thing about your doctor is that she's at her age, she's doing a cerclage without wearing her glasses." And I looked at him, I'm like, "Funny you ask." I adjusted my eyes, like it was like 48 hours or 72 hours after my eye surgery. But it worked so fast, and I want you to do it.
I'm going to do it.
One reason I kept delaying it was because I was so scared of someone touching my eyeball, because he said you can't have general anesthesia. And I kept telling him, if you're not going to put me to sleep, I'm not letting you touch my eyeballs.
I feel the same.
But I will tell you, I think they gave me Versed because I was very anxious. I got some ketamine. Is that what you do? I remember it, but I felt nothing, and I was kind of out of it. I don't even want to know what they did because it looks really scary when I saw the videos. But I will tell you, the minute they wheeled me out and I woke up, I don't know, how long does it take to wake up? Like half hour, 30 minutes, maybe?
So you go into twilight, therefore you have amnesia afterwards,
Right.
But you're awake during the treatment and in a state of euphoria. There's a cocktail that I learned to develop over the years for the patients. Of course, the anesthesiologist gives it. And we play your favorite music in the background. We give you some eye drops so you don't feel anything. We give you a little blink protector so you don't have to worry about blinking. You lay flat on your back. All Dr. A kept talking about, just like if you don't mind my sharing, she just kept talking about how beautiful the colors are.
Oh,
and
she's so sweet.
I saw all pink. Of course I did. I love pink. But I will tell you, in the post-op anesthesia room, I grabbed my phone and I was reading everything.
And you could see far away too.
Far, near. The only thing I had, which he warned me, for like 4.5, 5 months, I used to see halos around the lights, which I'm looking at it right now. It's completely gone. So that didn't really bother me because I read a lot. I'm always on my phone. It was life-changing. And the reason I wanted him to come here, he did it on my mom. She's 78 years old. Every time I call her, she's like, "This is the best thing I've ever done." It is life-changing for someone like you. You walk around with your glasses.
I walk around with this all the time, but then I forget them, and I'm like, "Oh, this is terrible."
But especially for working women, this is a game changer. And I was scared of it, and I didn't know what to expect. Besides the halos, I had no other issues.
And I promise you, people think right now, if they have LASIK, that there's nothing they can do about reading.
I hear that all the time.
So most people, when I tell my patients that I did this procedure and I don't need to wear glasses, 9 out of 10, they've never heard of it.
And you've been doing refractive surgery for 20 years. And so
I've been doing refractive surgery, for 35 years.
Can you talk about this Odyssey lens that you did the studies on?
So how is it that we're able to get everybody to see near and far? We use what's called diffractive optics, where the lens on the front surface of it has tiny little microscopic etchings in it, so that when a light source is coming from very far away, the only light that's going to reach you is the parallel bundles of light, the ones that are coming together, right? Those rays hit the lens in the exact same way as any natural lens would act. It gets focused on the retina. But when an object is nearby, the divergent rays hit those little etchings, and that also gets focused close. So whether something is near or far, you see just fine. And as new lenses come out, then the technology keeps improving. The ones I had 8 years ago are already 2 generations behind the ones that I gave Dr. A. Do I regret not having waited the 8 years? Absolutely not. I see everything near and far. Because at a certain point, when the technology gets so good, it's no longer the quality of the lenses as much as it is how much your retina can decipher, right? However, when Thaïs did ask me about it, I had already done imaging of her eyes, and I knew based on the shape of her particular cornea and the size of her particular pupil in different lighting conditions, there was a lens coming out that would be even better. And that's what she alluded to when she said the Odyssey. In your case, I knew based on the data that particular lens was the best match for you. Even today, I don't use the Odyssey for everybody, but I use it for a lot of people.
My husband wanted to do it. He went in and saw an eye doctor and he said, you cannot do it. There was something about the shape of his eyes that said, so who would not be a candidate for this?
More often than not, I find that people are a good candidate. They just need the proper lens to be a proper match for their
there's 12
particular
of them,
eye.
so it takes a very
there's a lot to choose from. Fortunately, as the newer generation lenses keep coming out, they satisfy a broader range of people. So I no longer pick from the 12. I now only pick from 4.
Okay.
And it makes it simpler. So who is not a good candidate no matter what? So if somebody has severe glaucoma, if somebody has macular degeneration, the retina itself is frayed, you're not going to get high resolution images. So for those people, it would be a waste to have it done. And in fact, because their neurosensory system can't interpret what's coming in, it can actually confuse it. So there is a small percentage of people for whom it's actually the wrong solution. Not only a non-solution, but the wrong solution. Those people still deserve to have their cataracts treated, but not with these lenses.
You know when you're doing all the right things for your health, eating well, working out, staying active, but you still feel like your energy runs out halfway through the day? That was me until I discovered Mitapure. A friend recommended I try Mitapure, and honestly, I was skeptical. But within a few weeks, I noticed a real change. My workouts felt stronger, my recovery time was way quicker, and I had the energy to keep up with everything else in my day. Mitapure works at the cellular level. Our cells are powered by these tiny energy producers called mitochondria. Think of them as your body's battery pack. As we get older, those batteries start to wear down. Mitapure contains a rare, clinically proven postbiotic called urolithin A that helps your body clear out damaged mitochondria and replace them with healthy ones. The result? More efficient energy production, better endurance, faster recovery, and real improvements in strength. For me, that's meant not just getting better performance in the gym, but also protecting my mobility, strength, and overall health as I get older. It's not just about today's energy. It's about setting myself up for the future. So if this is your year to feel like you're most energized, most revitalized, strongest self, give Mitapure a try. Think of it as recharging your body's batteries, unlocking the strength, power, and resilience you already have. I've made it a part of my daily routine, and I can't imagine going back. Timeline is offering 10% off your first order of Mitapure. Go to timeline.com/SheMD. That's TIMELINE.com/SheMD. I'm always on the go, and honestly, I was starting to feel run down. I wanted something that could actually support my health goals without being complicated, and that's when I found Symbiotica. They make high-quality supplements that have been such a game changer for me. One of my favorites is their liquid colostrum and vanilla sea salt. It supports hair, skin, nails, helps keep your gut lining strong, and gives your immune system a boost. I also love their liposomal, vitamin C, and citrus vanilla. Not only does it help with collagen production, glowing skin, and immunity, but because it's liposomal, your body absorbs it so much faster than regular vitamin C. What I really love about Symbiotica is how clean the ingredients are. No junk, no filters, and it's super easy to work into my routine. I even have my favorites delivered monthly so I never run out. If you're feeling like you need a little extra support, I can't recommend Symbiotica enough. I recommend Symbiotica. And right now you can try them for less. Just go to symbiotica.com/SheMD for 20% off plus free shipping. That's symbiotica.com/SheMD for 20% off and free shipping. This episode is brought to you by Opill, the first over-the-counter daily birth control pill available in the US. Okay, so let's just take a second to sit with how huge this is. For years, access to birth control has meant scheduling doctor's appointments, dealing with insurance, and just jumping through hoops. And now you can walk into a store or go online and get Opill. Opill is a daily birth control pill that is FDA approved, full prescription strength and safe for most people. It is a progestin-only pill, meaning it does not contain estrogen. Progestin-only pills like Opill have been FDA approved to prevent pregnancy for over 50 years. But now with Opill, the way you are able to access daily birth control pills is completely in your hands. As someone who believes deeply in making reproductive health more accessible and less intimidating, I can't tell you how exciting this is. Whether you're navigating birth control for the first time or just need more flexibility in your routine, this kind of access is a game changer. There is no prescription or doctor appointment needed, and you can find Opill online at most retailers. Opill is birth control in your control, and you can use code SheMD for 25% off your first month of Opill at opill.com. That's code SheMD at OPILL.com. Check out Opill to see if it's right for you. Do not use Opill if you have or ever had breast cancer. See Opill's label for a list of warnings. And once you do it, are you done for life, or do you have to sort of do it again?
Typically, it's permanent for life.
Okay.
The lenses themselves will last 5,000 years, especially, again, the highest quality ones. What would cause your vision to change again? If the eye remains healthy, usually nothing. You should be good to go. In the rare likelihood that over the years something changes about the shape of your eye, we wouldn't go back in and exchange the lens. That's when we would do a tiny bit of Lasik on the surface.
So can we talk about some things, dry eye disease, what happens to women in menopause? Our kids are always on their phones, and do those little glasses, dark blue light glasses work?
Those are great questions. They all kind of feed into each other.
Okay, great.
So what happens when we sit on screens? We normally blink 12 times a minute. Do you know how often we blink on screens?
3.
Good answer.
I did my research.
What happens as a result of that? When you don't blink, each blink releases water, oil, and mucus onto the surface of the eye. When you keep your eyes open, it evaporates. So the surface starts to get dry, which after a while you feel eye strain and the eyes burn, and people actually get secondary tearing because their reflex tears for crying kick in, etc. One of the most common symptoms in dry eye is excessive tearing. However, worse things happen than that. If you don't blink, eventually you don't produce any oil into the tear film, and you end up with permanent dry eye.
Should you just make yourself blink when you're watching
Yes,
the screen?
I tell the patients to put a little sticky on their screen that says blink. And every now and then just stop and blink a few times.
Blink a few times.
And so as we get older and enter menopause, the tear film decreases even more so.
Yeah.
So in menopause, the eyes become more dry, and therefore you want to be more mindful about all these things. In people who already have dry eye, we have to be more cognizant of first restoring some of their tear film production before we do LASIK. Refractive lens exchange, not as much because it's not affecting the surface of the eye. But menopause and decreased tears do go hand in hand.
What do you give them if that's happening?
As you can imagine, that tear film is very complex. To get oil and water to deal with each other, right? And there's a layer of mucus that comes onto the surface of the eye, the cornea. Then the water floats on top of that, and there's this thin oil layer that then floats on top of the water. The purpose of that oil layer is to prevent the water from evaporating too fast. And if you're not blinking and you're no longer producing oil, no matter how much water you produce, you're kind of out of luck. So we have a whole specialty for dry eyes now. We do everything from, believe it or not, shining bright lights into the skin to try and rejuvenate, kind of doing CPR, if you will, on those oil glands, to artificial tear films, to PRP eye drops, where we literally draw people's own blood and then separate out the growth factors and so forth and make eye drops out of it.
And plugging your lacrimal duct.
Put dissolvable collagen in the tear ducts so that the tears linger. What else happens to us when we get to that age, whether male or female, although women manipulate their eyelids more often, right? So they're more likely to start to experience this. They get lid laxity. The lower lid is not so tight anymore. Then when you blink, you don't get a proper tear film over the surface. Sometimes I'll send them to our eyelid specialists to tighten their lower lid. Well, there's so many different ways to tackle dry eye.
Well, that's what I was going to ask you. If you get your eyes done underneath, and could you harm that as well? Like if you...
Yes, of course. This is why there's a whole, one of the reasons why there's a whole specialty of oculoplastics, where surgeons who specifically specialize in the aesthetics around the eye, because it's very easy to create dry eyes. If you do the upper lids and you take too much of the skin, and then when people blink, their lids don't close all the way, and then when they sleep at night, their eyes stay open. As a corneal transplant specialist, which is what I started out as, I would see a lot of the real severe consequences of dry eye. Because if the surface gets dry enough, the cornea literally melts. Say they had rheumatoid arthritis, which is creates one of the worst forms of dry eye. So they'll get a little scratch, it's dry, immune system comes in overly active, corneal collagen melts. And so dry eyes can be very, very problematic.
And then if you go to the pharmacy and you get the drops, that doesn't help just to put the drops in?
The drops keep getting better. We now have drops that kind of almost mimic a little bit of the oil quality and the water quality mixed in with each other, etc. So the drops are very good. Think of them as Tylenol for a headache, right? It's not going to cure the headache, but it's going to help with the symptoms, right? So every person has a different ingredient missing in their tears. It depends on what aspect is causing it. Therefore, the one thing to consider is if you're having to use the drops very often, then get the preservative-free drops. Okay. Because if they have preservatives in them, you're just constantly putting irritant onto the eye, right? And once you've eliminated the preservatives, they're called preservative-free or no preservative. They usually come in little plastic ampules that you break off, and then whatever's in there still is only good for a day. If you have a little bit left over, throw it away at the end of the day. And then try the different ones, see which one, you know.
Are there any eye diseases or things that happen with the eye that are unique to women?
I think one of the key ones we touched on was dry eyes, because women are more prone to dry eyes. And also, a lot of the makeups can plug up their tear ducts so that they start to get excess tearing. But another thing is having to do with pregnancy and so forth, and breastfeeding, right? During pregnancy, vision can change.
Get blurry sometimes.
Any change that occurs during pregnancy tends to go back to its baseline after pregnancy. However, here's the big thing. If you're having vision change during pregnancy, run and get your eye examined, because it could be preeclampsia or eclampsia that you're starting to have, which is bleeding of the blood vessels in the back of the retina, and they just think, oh, I'm pregnant and my vision is changing and I get headaches because I'm pregnant, etc. That is a major emergency, and it's quickly diagnosable. If you look in the back of the eye, you literally see the blood vessels popping. And if you don't rush and do something about it and get that blood pressure under control right away, you have somebody who's either blind for life or dead.
I have a question. So many women walk around with fake lashes. There are brow serums for eyebrows. What do you think? I mean, I think
it's good stuff. The desire to have better lashes is understood. It's just so important in how it defines the look of the eyes, right? There's several ways to approach that. Putting on extra makeup to make the lashes thicker is a very easy and nice way to do it. Lash extensions, or fake lashes as they call them, and products such as Latisse. Latisse we discovered accidentally. It was as a byproduct of medications we use to control the pressure in the eye. What are its side effects? Eyes can get red. Eyelids can become permanently dark. If you don't want that, be very mindful. The second you start noticing it, it'll keep getting darker and darker and darker if you use it. I don't want to scare anybody. Very rare occasion, it can cause melanoma of the iris. So someone who has light blue eyes or light green eyes, if they start noticing that their eyes are starting to get little brown spots, it doesn't mean it's melanoma at that point. It just means freckles, right?
And
correct.
I am a side sleeper. I used to be a back sleeper until I had babies, and I had that big long pillow that I would stick in my the body pillow. And so if floppy eyelid and corneal stretching is something that happens if you're a side sleeper?
So side sleeping is comforting, and it's really hard to sleep in a single position all night long. However, if you had to pick a single position to sleep in, probably the healthiest is sleeping flat on your back of all. Keeps the spine straight, doesn't stress the internal organs squishing them, etc. Good for the facial skin, right? You don't wake up with a pillow face. I learned that if I stick a pillow under my knees, it's a lot easier to sleep on my back.
I just started doing that. But I snore like a banshee when I'm on my back.
Yes.
My husband was like, I have to get a separate room. But does it cause droopy eyes?
Depends. When you sleep on your side with a pillow pushing into the eyeball, it could give you a droopy eyelid. It could give you a lax lower lid. And it could even, you wake up with the eye feeling dry and irritated because the eyelid could get pushed open and the pillow can rub on the eye, right? What happens is the eyelid actually flips over when they're sleeping, or the lashes actually push into their eyeball. And they get, a lot of irritation. And the way we treat that is just simply giving them a plastic shield to wear over the eye at bedtime if we can't break the habit of, sleeping face down or on the side.
Well, I'm working on the back sleeping. Ladies, can we talk about finding shoes that actually work with your lifestyle instead of against it? I used to be able to run around town from day to night in sky-high heels. Well, sadly, those days are over for me. And that's why I'm so excited to tell y'all about Vionic. Vionic has the best essential styles for everyday wear to get you ready for the summer season. Let's talk about a few of my favorites. First up, the Uptown Wilma. This is your new everyday essential. Vionic's most coveted style, the Uptown Loafer, has a new friend. Part sneaker, part mock. This new streamlined design delivers wearable well-being for your feet. You can wear them running errands, and they're the perfect sweet spot between comfortable and put together. Then there's the classic Uptown Loafer. The Violab engineered part loafer, part sneaker is the technology and style you keep voting for, and so does the press. These literally go with everything from jeans to dresses. For summer, I'm obsessed with the Wanderer. The Wanderer is your new active sandal designed with all the Vionic walking technology you know and love. With 3 points of adjustability and supercritical foam for extra cushioning, it's designed to walk. They're perfect for vacation or just everyday summer wear. What sets Vionic apart is their exclusive VioMotion technology. Every shoe in Vionic is powered by their VioMotion technology. Ready to try them? Use code SheMD at checkout for 15% off your entire order at www.vionicshoes.com. And when you log into your account, one-time use only. You know what I've been obsessing over lately? My morning routine, and specifically this one thing I've added that honestly has been a total game changer, Live Conscious Collagen Peptides. I love to wake up before anybody else gets up in the house. I go downstairs, I get my coffee, it's still a little bit dark. I walk outside, put my feet in the ground, and watch the sun come up. After my coffee, I've started doing Live Conscious Collagen Peptides. Here's the thing. As we age, collagen levels drop, especially during hormonal changes. And I started noticing it. My skin wasn't bouncing back the way it used to. My hair, which was so thick and gorgeous my entire life, felt a little different. I needed something that could work from the inside out. And that's when I heard about Live Conscious Collagen Peptides. A clean, clinically backed way to support my skin, hair, and joints from the inside out. What I love most about it? It's clinically backed and free from harmful and unnecessary additives, which is why it's become a daily non-negotiable for so many women. At Live Conscious, their mission is to create simple, effective wellness solutions that elevate your everyday life, one conscious choice at a time. Best part, these peptides dissolve effortlessly into your morning coffee, smoothie, or even water. No clumping, no fuss. I just stir it into my coffee every morning and I'm done. They know what they're doing and they stand behind it. In fact, they're so confident you'll love the results that every purchase comes with a 365-day money-back guarantee. Head to liveconscious.com and use code SheMD for 15% off your first purchase. Summer means breezy dresses, bold colors, and all the effortlessly cool looks you've been waiting to wear. Whether you're heading to rooftop brunches, garden parties, or just soaking up the sun in your favorite sundress, let's talk about what's underneath, because the right shapewear can make all the difference. I have to tell you about Honey Love's shapewear because it has completely changed my relationship with getting dressed. I used to think shapewear meant choosing between comfort and looking good. I was skeptical at first. I mean, is shapewear ever really comfortable? But their mesh sculpt technology is a total game changer. It's breathable and lightweight without sacrificing its power. It keeps you cool while delivering that sculpted silhouette you want. What I love most is their targeted compression technology. It smooths and shapes exactly where you want it to and eases up where you don't. It works with your body, not against it. Plus, thanks to flexible boning on the sides, it stays in place. No rolling, shifting, no awkward adjusting mid-conversation. Treat yourself to the most comfortable shapewear on earth and save 20% off site-wide at honeylove.com/SheMD. Use our exclusive link to get 20% off, honeylove.com/SheMD. After you purchase, they'll ask you where you heard about them. Please support our show and tell them we sent you. Experience a new standard in shapewear with Honey Love. I want to hear how you created Eagle Eye LASIK and how it's different.
So the concept I started developing over 20 years ago, and I published on it. Initially, I called it temporal hinge, a long title. And the title for Eagle Vision itself is quite long: elliptical flap aberrometry guided laser enhanced vision. It's a technique of LASIK I developed initially for super athletes, but then we discovered this is the best for everybody. If you think of the eye as a camera, it has two lenses. LASIK works on the outer lens, refractive lens exchange works on the inner lens, and therefore refractive lens exchange is more permanent.
Okay, and so with LASIK, are they just cutting off your top thing, pulling it up, and then fixing the curve of your eyeball? Is that the simple version?
Yeah, with LASIK, we create a flap in the cornea. We use a laser to reshape the cornea. Flap goes down. The power has been changed. People can see.
Can we talk about glaucoma? I was reading that it happens more in women, but it's just because they live longer.
Right. Same as cataracts. We have more female patients because they're both conditions that come on with aging, as with macular degeneration, which is another one that comes on with aging. So it's not surprising that we have more female patients because women live longer than men do. We're born with about a little over 1 million fibers in that nerve. Every year we lose 1% from natural aging. People with glaucoma lose them faster. Most common reason for that is higher pressure in the eye. That's why you see very often, most people with glaucoma are talking about using eye drops, because we're giving them eye drops to lower their pressure.
And why do they have more pressure? What causes that pressure?
There's constantly fluid produced inside the eye, and there's constantly fluid that drains from within the eye. Think of a sink. If you turn the faucet up so fast that it overwhelms the drain, the water will build up, right? And glaucoma is that way. The dynamic between production of fluid in the eye and the drainage of fluid in the eye becomes altered. What do we do about it? Depends on the cause, but if we believe that it's too much fluid being produced, we use a certain kind of medication. If we feel it's the drainage system is plugged, we use a different type of medication. So glaucoma eye drops are quite good. We also have laser surgical procedures for glaucoma and other even more invasive procedures for glaucoma for the people in whom eye drops don't simply remedy their condition, or people who don't want to use the eye drops.
Can you tell us about macular degeneration?
Yes. Macular degeneration, when it comes to loss of sight, in some ways mimics the opposite of glaucoma. With glaucoma, as those nerve fibers are damaged that go to the brain, you lose your vision from the outside in, and you're not aware that you're losing any vision. That's why it's called the silent thief of sight. Because by the time you start to realize in glaucoma you're losing vision, it's almost too late. Macular degeneration is the opposite. You start to lose the central vision first, because it's the retina itself, the central seeing part of the retina. So things start to go kind of blurry and lines look like they're starting to break up. And then when it gets severe, at first, I might be looking at the two of you and I might see everything around you, but I can't recognize your face. if I look off to the side a little bit and I still have good side vision, I can kind of recognize your face. And then over the course of time, it can expand. And it used to be there was nothing we could do about it. Fortunately, we've come up with medications over the years where people go to their retina doctor and they get an injection in the eye periodically, right? It reverses the action of those abnormal blood vessels.
That's amazing, though, that if it can reverse that, that things are happening at such a fast rate in medicine.
Yes, absolutely.
And what sort of doctor would you go to if you...
Retina specialist. You can go to an ophthalmologist.
Okay.
Preferably in certain areas, you may not have a retina specialist. You may have an excellent general ophthalmologist who's very comfortable giving the injections.
What about retinal detachment?
Retinal detachment is just as it sounds. It's the retina when it loses its adherence to the back wall of the eye. And it's the early symptoms that are important to recognize. If you start noticing a lot of fresh, new flashing lights, it could mean that something is tugging on the peripheral retina. And you want to go in and see your retina specialist so they can examine you and make sure that a little tear hasn't developed. Because if there is a little tear and it's detected early, we just put a layer of laser right around that tear. It seals it. If it advances beyond what I described, you start to feel like there's a curtain or veil over part of your vision. That means more of the retina has started to come off. And if you keep ignoring those symptoms, eventually it comes off to the point where it separates the central seeing part of the retina. And now, if you don't fix that right away, you can't retrieve the vision.
Wow.
So if you think you've scratched your cornea, what do you do? Will it get better on its own? Do you need to go see an eye doctor?
Once you have the scratch, yes, it is important to go in and be seen. Why? The cornea has no blood vessels to help it as an immune system, right? And it gets a lot of its oxygen through the air. Mm-hmm. And its defense is the blink, because bacteria that come in keeps blinking them away, right? And the dead skin layer on the surface. So once you scratch that dead skin layer, organisms can get into the cornea very easily now. So you want to go in and be seen, and you're usually very motivated to go in and be seen because it's the most awful pain, right? And then we will usually examine, make sure there's no signs of infection, and begin antibiotic drops.
What are styes, and how do you treat them?
Styes are either due to just inflammation or infection, and if you're getting a lot of styes, start thinking more about more frequent hand washing. Think about when you're taking a shower in the mornings to lather up the soapy water and lather up your lids and lashes, let the water run down, those types of things.
How do you treat a stye?
Early on, you can treat it by trying to let that oil gland that's gotten plugged open up. So you can put at home, you can put warm compresses on it, right? Trying to get it to open up. Maybe you have your doctor call in an antibiotic ointment you put on the eye, etc. If it doesn't open up easily, then you can go into the office and they can express it for you. Or if it becomes very clogged and becomes what's called a chalazion, which is kind of the next stage of its development, then we evert the eyelid and we drain it from the inside.
Ooh, that will hurt. No, thank you.
You don't feel it.
Are there any ingredients women should stay away from in makeup for their eyes?
So the biggest problems I see with makeup with women is it's allergies. And if they're having a lot of allergies and eye itching and irritation, and they should go get hypoallergenic makeup. Okay. Again, there's no brand that I would necessarily recommend. On that subject, don't rub your eyes.
Just because why?
Eye rubbing can do lots of things. You sit there and do this, right. You're going to cause all kinds of problems.
And the dirt and everything else that you have on your hands.
In fact, severe eye rubbing is the #1 cause, in my opinion, of corneal transplants.
So if you could give one piece of advice to anyone out there listening how to keep healthy eyes, what would it be? So
it used to be that cataracts were the #1 cause of blindness, and in a lot of parts of the world they still are. Then glaucoma became the #1 cause of blindness, but we got smarter at how to treat that. Now macular degeneration is the #1 cause of blindness.
Thank you so much. This was honestly just a masterclass in the eyes, and I'm always so scared of the eyes. I've been really scared of the eyes. They're so delicate. You know, there's not very many things on the body that are so delicate.
There's good reason why people get so squeamish about their eyes. 50% of the nerve endings in the brain serve vision function.
Wow.
All the other 50% are for locomotion and memory and feelings and temperature and all the sensory system. 50% goes just to your eyes. It's no wonder that we have evolved to be so dependent on our eyes and therefore are so protective of them.
You know, the eyeballs are less scary for me now after hearing all this from you. But so I've learned so much. Eat your antioxidants. Blueberries are amazing. And don't rub your eyes.
Thank you for coming.
Oh,
we
my
love
pleasure.
having
You're
you.
amazing.
We
My
learned
pleasure.
everything about eyes today.
Thanks so much for joining us today on SheMD.
If you want to own your own health, a good place to start is by following us on social media at SheMD Podcast and by subscribing to our show on YouTube or wherever you get your podcasts.
For takeaways from today's episode, visit our website, shemdpodcast.com. We'll see you next time on SheMD. This podcast is for educational and entertainment purposes only. It is not intended as a substitute for a physician's medical advice. You should regularly consult your medical provider in matters relating to your own health. Even though we share our honest beliefs on SheMD, some of the products and services we discuss may involve sponsorships or paid advertising.